السلام عليكم ورحمة الله وبركاته.
وعليكم السلام ورحمة الله وبركاته دكتور ياسر.
حياكم الله.
الله يحييك دكتور. تقدر تسوي شير شو اسمه ذا السلايدات اللي عندك من خلاص دكتور نبدأ بسم الله.
توكلنا على الله.
طيب بسم الله الرحمن الرحيم والصلاة والسلام على أشرف الأنبياء والمرسلين. ترحب بكم وحدة خدمة المجتمع بكلية الطب والمستشفى الجامعي بجامعة الملك عبد العزيز في برنامج حكاية تخصص. موعدنا اليوم مع الدكتور ياسر فادن العميد المشارك للدراسات العليا بجامعة الملك سعود بن عبد العزيز للعلوم الصحية ورئيس قسم امراض النساء والولادة ورئيس لجنة الاختبارات لتخصص امراض النساء والولادة في هيئة التخصصات السعودية الصحية. دكتور ياسر المايك عندك تفضل، ونعتذر من الجمهور للتأخير اللي حصل لكن الحمد لله حلينا المشكلة.
طيب بسم الله الرحمن الرحيم، الحمد لله رب العالمين والصلاة والسلام على نبينا محمد وعلى آله وصحبه أجمعين. في البداية أحب أن أشكر جامعة الملك عبد العزيز لاستضافتي في هذا اللقاء مع أطباء الامتياز وطلبة السنة الخامسة والسادسة الطب في جامعة الملك عبد العزيز. اللقاء حيكون باللغة الإنجليزية إن شاء الله. So I'd like to again thank King Abdulaziz University for inviting me to be with you tonight to share with you some information regarding the specialty of obstetrics and gynecology, because I'm sure some of you probably have in your minds the possibility of being future obstetricians, gynecologists. So inshallah, I'm going to give you a glimpse of what this specialty is about and inshallah answer your questions as much as possible. So what I'm going to be talking about mainly in this presentation for the next half hour is first of all, how to choose wisely your specialty or your future career that you're going to live with for the rest of your life, whether that's obstetrics and gynecology or any other specialty. Then I'm going to be giving you some information on the Obstetrics and Gynecology Residency Training Program under the Saudi Commission for Health Specialties. I'll be talking to you a little bit about some of the subspecialties that we have in obstetrics and gynecology, because once you finish the residency training program and you become board certified in obstetrics and gynecology, you have the choice of furthering your career and choosing one of the subspecialties in obstetrics and gynecology. I'll be talking about the workload in obstetrics and gynecology, the possible lifestyle that you'll be living as an obstetrician gynecologist, and some reasons why you would choose this specialty, and maybe reasons why you should not choose this specialty. So let's start off with choosing a medical specialty. So I don't know regarding other colleagues who presented their specialties to you in the past or are still going to in the future, if they come to you and they try to sell their specialty to you in order to choose that specialty to become your future career, I'm not going to do that because I don't think that it's a matter of selling your future to you. It's really something that you have to choose wisely, and you have to choose based on certain facts regarding your own life, regarding your own personality. I strongly recommend that you read one of the many books that are found, in the bookstores or on the internet on choosing a medical specialty. This is just one example that I posted here that you can see on the slide. So there are many books that can help you or guide you to choosing a medical specialty. Another one, actually, you can download from the Saudi Commission for Health Specialties website. So they have this booklet on medical specialty selection guide for medical students or medical interns. So again, this is, I think, is a very useful book that can also help you choose your medical specialty. In this medical specialty selection guide written by the Saudi Commission for Health Specialties, it was written approximately 10 years ago, but it's still very useful. They talk about the Myers-Briggs personality type. And the Myers-Briggs personality type is something that you should all read about as interns. You should try to figure out your personality type. Why? Because in the early 1900s, a guy by the name of Carl Jung, he theorized that there are 4 primary psychological functions by which we human beings experience the world. They are sensation, intuition, feeling, and thinking. Now, Carl Jung's wife and daughter, by the name of Briggs and Myers, they expanded this theory to create a personality question that would eventually turn into the Myers-Briggs type indicator, known as MBTI. And this was in 1962. Now, this test produces a combination of 4 dichotomies: extroversion versus introversion, sensing versus intuition, thinking versus feeling, and judging versus perception. So you need to analyze your own personality type. Which personality type do you have? Extroversion versus introversion, sensing versus intuition, thinking versus feeling, judging versus perception. Now, most people are familiar with this test and know that the test produces a 4-letter personality type. For example, if you are ESTJ, that means you are primarily a sensing, thinking, judging extrovert. Now, there are 16 different personality types in all. And during the internship year, you need to figure out which of the 16 personality types you have. Personality and medical specialty often go hand in hand because different medical specialties require different types of people. So again, you can find in the medical specialty selection guide by the Saudi Commission for Health Specialties, based on the Myers-Briggs type indicator. So it shows you the different personality types and the different specialties that probably fit to that personality type. If you notice here, obstetrics and gynecology is ESTJ, or some people consider it ISTJ even. So, so this you might find handy. So again, some more personality types and also the different medical specialties. Now, for obstetrics and gynecology, usually the personality type, the person you would find is introverted, sensing, thinking, and judging, which means usually the personality is a quiet personality. Those people are usually quiet. They're also serious. They earn success by thoroughness and dependability, so you can really depend on them. They're very thorough, and what we hear about them being like type A personalities. They are practical, realistic, and they are responsible people. They decide logically what should be done and work towards it steadily, regardless of distractions. And they also take pleasure in making everything in order and organized. Not just related to their studies or to their work, but also to their home, to their life. Usually they value traditions and they are very loyal people. So that was with regards to the personality type. So if you feel that you have these characteristics, then yeah, you might be, you might well be a good obstetrician gynecologist in the future. Now, this is just the front cover of our obstetrics and gynecology curriculum that was published by the Saudi Commission for Health Specialties. This is also something that you should probably skim through during your internship year, just to have an idea of the training program, whether it's obstetrics and gynecology or even other specialties, just for you to have a feel of what they're going to be doing during their 4 or 5 or more years of residency training. Now, the mission of the Saudi Commission with regards to residence training is to graduate competent, safe, skilled, and knowledgeable specialists capable of functioning independently in the field of obstetrics and gynecology. So in other words, when you finish your training, you'll become from a resident who was dependent on their seniors, whether they were registrars or consultants, and they're going to become independent, and they're going to be future consultants working independently, whether it's going to be in governmental hospitals or in private. So what is the structure of the residency training program? It is a 5-year residency training program. The junior years are R1 to R3. The senior years are R4 and R5. There are annual promotion exams. So in order for you to be promoted from one year to another, you have to sit a promotion exam towards the end of the year. And there are also two part exams. There's a part 1 exam in order for you to be promoted from the junior residency levels to the senior residency levels. And then there's the final part 2 exam, which consists of 2 parts, a written exam and a clinical exam. The written exam is, a multiple choice exam, about approximately 300 to 400 multiple choice questions, and a clinical exam that consists of stations, whether they are OSCE stations or structured oral stations. This is the general framework of the required rotations. So while you're doing your residency training, you're going to be rotating in different areas. So you're going to be taking some general obstetrics and gynecology. You might be covering the labor and delivery room. You'll be doing rotating with maternal fetal medicine, having an ultrasound rotation, focusing on obstetric ultrasound and also in gynae ultrasound. There is a research rotation, which is for 6 weeks, because usually you will not be allowed to sit for the part 2 exam until you have submitted a research. So other areas that you'll be rotating in is, the other obstetrics kind of subspecialties like urogynecology, gynecology, oncology, and also other specialties, that are close to or that work collaboratively with obstetrics and gynecology. So there is a rotation in anesthesia, and there's also a 1-month rotation in ICU. Now, these are the top conditions that are encountered in obstetrics and gynecology here in Saudi Arabia, and this is found, you can find this in the curriculum. So, just mentioning here again, so these are the vaginal bleeding, labor pain, acute abdominal pain, and then obstetrics-related issues like preterm labor, premature rupture of membranes, and others. Now, the subspecialties. So we have a few subspecialties under obstetrics and gynecology. We have maternal fetal medicine, and maternal fetal medicine, we do have a fellowship program under the Saudi Commission or accredited by the Saudi Commission for Health Specialties, and in Saudi Arabia. So we have approximately 5 centers that offer the maternal fetal medicine fellowship training program. 1 here in Jeddah, which is the National Guard Hospital, and 4 centers actually in Riyadh. Reproductive endocrinology and infertility is another subspecialty, and there is also an accredited program in Riyadh. Gynecology, oncology is another subspecialty. Urogynecology and reconstructive pelvic surgery, minimal invasive gynae surgery, pediatric and adolescent gynecology, and women's health. So maternal fetal medicine is one of the subspecialties, and it has to do with taking care of women who have complications in pregnancy, whether these complications are medical complications during pregnancy, hypertension, diabetes, cardiac disease, or surgical complications during pregnancy, or problems related to the fetus. So abnormal fetal growth, or congenital anomalies, or genetic abnormalities in the family. The maternal fetal medicine specialist will be looking after the patient in this type of high-risk pregnancy. Reproductive endocrinology and fertility. So again, these are the conditions that they follow: polycystic ovary syndrome, endometriosis, problems related to reproductive endocrinology, really, and infertility. So infertility comes under this subspecialty: reproductive endocrinology and infertility. IVF comes under this subspecialty. Another subspecialty is urogynecology and reconstructive pelvic surgery. So again, another very important subspecialty. Fortunately, recently we have had several centers with accredited urogynecology fellowship training programs in the kingdom. Again, most of them, or I think all of them actually, are in Riyadh. We have minimal invasive gynae surgery. So usually this has to do with, minimal invasive surgery. So laparoscopic surgery or hysteroscopic surgery. And we know that there are many advantages for minimal invasive surgery. So again, this is another fellowship that is offered abroad in North America, in the UK, but not yet here in Saudi Arabia, unfortunately. Gynecology, oncology, so everything related to malignant neoplasms in the female reproductive tract is dealt with by the gynecological oncologists. And are there any fellowship training programs here in the kingdom? There is, again, in Riyadh. Yes, I think in King Faisal Specialist Hospital. Another subspecialty is pediatric and adolescent gynecology. So again, this is related to caring for children, adolescents, young women with gynecological concerns. So these are basically, the main subspecialties under obstetrics and gynecology. With regards to the workload, this is a very common question. Is there heavy workload for obstetricians and gynecologists? The quick answer is yes, there is, of course, especially we're a country where there are lots of deliveries. So especially when we're talking about obstetrics, there is a heavy workload. And this does affect the satisfaction of the obstetrician gynecologist. So in this paper that was published in the American Journal of Obstetrics and Gynecology, if you read here the conclusion, it was found that that 2 primary contributing factors of dissatisfaction were identified among obstetrician gynecologists who performed deliveries with increased workload and decreased personal control, because really you cannot control the workload. Deliveries, when you're going to be having patients who present in labor, you cannot control that. They present anytime in the day, 24/7. So it's really not in your control. With regards to lifestyle, so how is the lifestyle of the obstetrician gynecologist? And again, this is based on this report that was published Medscape. It was the Lifestyle and Burnout Report published in 2018. If you notice here, answering the question, which physicians are happiest outside of work? So outside of work, you'll find that the obstetrician gynecologist is midway, right? About 51%. So not too bad and not that wonderful also. Next question regarding lifestyle. Which physicians are happiest at work? So again, obstetrician gynecologists fairly midway. Which physicians are burnt out, depressed, or both? Unfortunately, you'll find the obstetrician gynecologists here at the top of the list. So number 3, actually, after neurology and critical care. So something to consider. Do male or female OB-GYNs report higher levels of burnout? So again, yes, females usually get burnout more than males in this specialty. So I'm almost going to conclude to allow time for questions. Now, reasons why you would choose the specialty. So as I said in the very beginning, it matches your personality type. So please analyze your personality type and find out if you would fit in obstetrics and gynecology or not. Another reason why you would choose a specialty, and usually we hear this when we're conducting interviews for interns who are applying for the residency training program, is they say because it's a mix of medicine and surgery, and that is true. So there is a nice mix of medicine and surgery in obstetrics and gynecology. Another reason why you would choose the specialty is because it's fast-paced specialty. You know, you have things that patients who come in emergency, you have to assess them quickly, you have to make a quick decision and quick action. So similar to ER, emergency medicine specialty. Quick decisions, as I just said, and outcome. Another reason why you would choose a specialty is because you can see the outcome, immediately. You don't have to wait for days, weeks, months until you see a patient outcome. So a patient presents complaining of abdominal pain and labor. In a few minutes or hours, she'll deliver the baby and you'll see the outcome. Patient communication. So this is another reason you might want to consider choosing the specialty. So if you like, the doctor-patient interaction or communication, then there is a lot of physician-patient interaction in the specialty of obstetrics and gynecology. So this might be another reason why you want to choose the specialty. So reasons not to choose obstetrics and gynecology. So obviously, if it's not matching your personality type, don't choose obstetrics and gynecology. Another very important reason not to choose a specialty. If you don't like seeing blood or you don't like bloody specialties, then obstetrics and gynecology is not for you. Not even surgery, but especially obstetrics and gynecology. And obstetrics and gynecology is a more bloodier specialty than surgery, actually. Medical legal litigation. So this is another reason if you're going to be fearful of possible medical legal litigations or accusations, and you would have to go to court. Again, obstetrics and gynecology is one of the specialties, probably the most common specialty where there are medical legal litigations against the doctors, unfortunately. So probably another reason why you might want to not consider choosing the specialty. Breaking bad news. So again, we do break good news, alhamdulillah, to some patients, but again, sometimes we do have to break bad news. So if you are the type of person who doesn't like to break bad news to the patients and might be affected by it, then probably you might want to consider choosing another specialty. So we'd have to break bad news, for example, if the baby is not doing well, if the baby has a congenital anomaly, if the baby died in utero, if, for example, patients diagnosed with gynae cancer. So these are all examples where we would have to break bad news to patients. On-calls is another probably strong reason why lots of people don't choose the specialty, because your on-calls are going to be in-house, not like in other specialties where you can actually take on-calls from home. So, and in some hospitals, like in our hospital, in the National Guard, for example, the consultant takes their on-call in-house or in the hospital, unlike other specialties where they all take their on-calls from home. So again, yes, this is a disadvantage, something to consider. So with that, I'm going to conclude here. I hope I gave you some information regarding the obstetrics and gynecology specialty and residency training program here we have in the Kingdom under this Saudi Commission for Health Specialties. So if you have any questions, please feel free to ask.
دكتور تبغى نشوف بعض الأسئلة الآن؟
أيوة تفضل.
طيب في دكتور أسئلة بتتكلم عن هل في السب سبيشاليتي حقت الأوبي جايني في كوزمتيك سب سبيشاليتي؟
Yes, these are fairly new subspecialties now that are available, and but not here in the Kingdom. So we don't have it here in the Kingdom, but it is available in certain areas around the world, like in North America and the UK.
اوكي طيب دكتور في سؤال كم سنة دراسة التخصص؟
هذه أنا ذكرتها في البرزنتيشن. الدراسة 5 سنوات. Residency training program is 5 years. 3 years junior years, and years 4 and 5 are the senior residency years.
طيب دكتور في سؤال بيتكلم عن during the internship إيش how to impress the consultant to get a recommendation وبرضه كمان يساعدك بعدين في الانترفيوز. إيش الشيء المفترض تقدمه؟
I think the same things you would do to impress any consultant in any other specialty. I mean, consultants are usually impressed by people who show interest. So meaning attending all activities, attending on time, being punctual, attending the clinics, being available all the time, being available during rounds, and also even presenting topics, whether it's during the round or as a presentation for the whole department. So these are usually things that would impress the consultant and would make them remember that in turn when they come for the interview later on.
اوكي ما شاء الله واضح. طيب دكتور تحب نكمل بعض الأسئلة الآن ولا نخليها في الأخير كمان؟
هو متى الأخير؟
يعني على هو شو اسمه ذا الوقت المفترض الساعة 10:45 نخلص العرض ونشوف الأسئلة حقت الحضور.
لأنه أنا العرض خلص
العرض خلص؟
أيوه أنا تركت مجال للأسئلة يعني لو في أسئلة.
خلاص. طيب الحضور الكريم اللي عنده أي سؤال يتفضل يطرح الآن لأنه الدكتور هم متعودين على أساس إنه نهاية العرض بس خلاص الحين يطرحون الأسئلة. في دكتور سؤال بالنسبة للسب سبيشاليتيز إيش النادر منها؟ إيش المطلوب الآن موجود في السعودية أكثر شيء؟
السب سبيشاليتيز الموجودة كتدريب داخل السعودية اللي هي طب الأمومة والجنين Maternal Fetal Medicine. في 5 مراكز توفر التدريب لتخصص طب الأمومة والجنين، 4 في الرياض و1 في جدة. في طب Reproductive Endocrinology and Fertility والعقم هذا موجود في الرياض فقط، والجاينيكولوجي أونكولوجي أورام النساء. هذول 3 most common subspecialties, and we do have a fellowship training program here in Saudi Arabia. The other subspecialties that I mentioned in the presentation, اللي هو minimal invasive gynae surgery, women's health, are found outside. We don't have them in the kingdom. Urogynecology we have here in the kingdom, Urogynecology fellowship, وبرضه موجودة في الرياض فقط.
كم طيب دكتور، في كلام عن مسألة الأوتكم بعدين من ناحية الدخل المادي للأوبي جاين كتخصص.
الأرزاق بيد الله. الدخل المادي يعني I don't know what يعني إيش المقصود يعني بالدخل المادي؟ يعني
أعتقد الدكتور سؤال قصده متوسط الدخل المادي بالنسبة لهم.
يعني هو بيعتمد، إذا إحنا بنتكلم كاستشاري لا دخلهم المادي يعتبر طيب، لكن بيختلف يعني في يتراوح يعني على حسب مكان العمل.
Okay.
The salaries are not fixed, they are variable. طيب لكن overall we can say that obstetricians and gynecologists, you know, they receive you know a very good salary إن شاء الله.
إن شاء الله بإذن الله. دكتور في سؤال بالنسبة للريزيدنسي، إيش من وجهة نظرك تشوف الشخص هل يحاول ياخذ اكسبيرينس كمان للأوبي خارج السعودية في كندا أو أمريكا أو ممكن في أوروبا، ولا في البروجرام السعودي؟ إيش الادفانتجز هنا وإيش الديسادفانتجز في البروجرامز اللي برا؟
إذا إحنا بنتكلم عن postgrad education فطبعا we have residency training programs here في السعودية، وفي طبعا postgrad education outside. If we're talking about North America, طبعا North America they have very strong residency training programs and fellowship training programs. مين أفضل؟ I can tell you that our residency training programs here in Saudi Arabia are strong, but again, it really depends on the center where you're going to be doing your residency training. So definitely some centers are stronger than others. If you have the opportunity to go to do a residency outside, في scholarship that you're able to have and go and do postgrad, again, this would be an excellent choice. لأنه residency training programs برا يمكن أقوى من ناحية gynecology, because they have more gynecology cases there. More the surgical volume usually in North America, whether in the States or Canada, is a higher volume. And of course, when you do more surgery, more cutting, you're going to be more skillful, more competent.
واضح دكتور. دكتور في سؤال صراحة تكرر كثير، ألا وهو as a male work in OB-GYN، إيش التأثير حقه من ناحية البيشنتس؟ إيش النظرة له؟ هل يعني تخلي الواحد يفكر reconsider ولا في تقبل من المجتمع؟
هو في تقبل، يعني هو يعني وجود الميل في تخصص النساء والولادة يعني they're not going to be rejected if this is the question. يعني are most of the patients going to be rejecting males? No, but the male residents or male physicians might be having patients who are going to refuse to be seen by a male physician, and this is their right, of course. لكن it's not a big number. يعني ما حيأثر في تدريب الدكاترة، ويعني وبالعكس مستقبلا especially after you finish your training program and if you become you know very competent an excellent physician, actually people are going to be coming to you by name, and will be probably preferring you over female physicians كمان.
اوكي واضح يا دكتور، يعطيك العافيه. في دكتور كمان سؤال بيتكلم عن السي في. ايش اللي ممكن انت تضيفه في السي في تبعك يزيد نسبه قبولك ويرشحك اكثر من بقيه الزملاء في الاو بي جايني؟
في السي في first of all يعني I think you already had a lecture on how to write a CV صح during this week.
اي صحيح.
ايوه first of all you need to make sure that your CV is very neat when it's written and not sloppy. Meaning in other words it has to be organized. English has to be يعني correct English. Usually when we see CVs with lots of spelling mistakes, this is one of the reasons why we would put it aside. So make sure that, the English is good English, spelling is correct, it's organized. For obstetrics and gynecology, if you were involved in any obstetrics and gynecology courses, workshops, be sure to include it in the CV. If you attended any conferences, workshops, they also مثلا advanced life support in obstetrics. Lots of interns do this during their internship year, and this increases their chances for being accepted because it shows that they have interest in the specialty. Also, if they were involved in any research related to obstetrics and gynecology. Again, this is another very important item to be included in the CV.
واضح دكتور. دكتور كمان في سؤال بيتكلم على الفيلوشيبس later on في السعودية، هل هي متوفرة ولا في نقص لسه موجود فيها؟
الفيلوشيبس زي ما قلت maternal fetal medicine is number one with regards to the number of training programs and the number of applicants being accepted. So this is maternal fetal medicine. After that, other subspecialties بصراحة they accept very few candidates per year. So not that much. اللي هم urogynecology والinfertility probably gyne-oncology يعني حتى the centers are very very minimal يعني. Usually people after they finish residency they would seek for fellowship training programs برا السعودية abroad.
دكتور في سؤال بس اعتقد شوية كذا دكتور هو in details اللي يتكلم عن ايش شروط القبول في الحرس في الريزيدنسي بروجرام اوف او بي جايني.
يعني شروط القبول اولا يعني you have to be matched to us. فتدخل الماتشنج حق الهيئة السعودية. Once you're matched to us, you will receive a phone call to come and do an interview with the Residency Training Program Committee in the National Guard Hospital. The Residency Training Program Committee consists of 5-6 people, including the chief resident, and they will interview the candidate for the training program. الشروط المعدل طبعا is very important. فعادة مثلا إذا المعدل من 5 عادة في الحرس يقبلوا معدلات فوق 3.5 من 5. Below 3.5 most likely they will not be accepted. This is according to the policy of the National Guard سواء كان رياض ولا جدة. بس غير كذا ما في preference. هذا سؤال ثاني دائما يتكرر، هل انتم تفضلوا خريجين جامعتكم من الجامعات الاخرى؟ No, not necessarily. احنا it depends on their performance, their GPA, their SLE score, and their performance if they did their internship with us. يعني again, doing an internship with us in the National Guard is probably gives you more chance of being accepted because the people would know you.
ممتاز واضح دكتور. في دكتور سؤال بالنسبة للانترفيوز، إيش الكومن كويستشن اللي ريليتد للأو بي جايني بتطرح علينا في الانترفيو أو ممكن تطرح؟
سؤال جيد. يعني تبغوني أغششكم؟ طيب. لا, يعني usually the questions that are asked يعني during an interview is you know, why are you interested in obstetrics and gynecology, and why usually people would ask why you chose their center, you know, to come and do the interview in. Then there's probably other questions. Sometimes, you know, some centers they would ask questions related to the specialty. And usually the questions when they are asked ما هو عشان يعني اختبار يعني المعرفة في تخصص نساء والولادة، ولكن اختبار ردات الفعل، يعني the attitude, the reactions that the candidate would have in specific situations.
اوكي، يعني دكتور يعني حتى لو هو ما يعرف ايش الكوماند اوف تشينج اللي هو حياخذه، صح؟ يعني حيطلع ايش التصرف المفترض هو يسويه حتى لو ما يعرف ايش الجواب حق السؤال؟
كيف يعني؟ ما فهمت السؤال.
يعني مثلا دكتور في تسلسل المفترض، يعني اذا هو ما عرف ايش يسوي في السيتويشن المعين المفترض يطلع للريزيدنت، بعد الريزيدنت يطلع للسبيشالست، صح زي كذا؟
ايوه، يعني this is one example، يعني to see if they know the chain of command. يعني if they're a resident, if they run into a problem, who would they go to? يعني usually the resident, if they have any problems related to their training, they go to the chief resident and then to the program director. Again, this you know, questions like these are asked. يعني لأنه it tells you that this person knows about residency training, knows you know the chain of command, and knows about, you know, the policies with regards to escalating issues in their training.
اوكي، واضح دكتور، يعطيك العافيه دكتور، وشاكرين لك على المعلومات اللي اثريتنا فيها سواء بالتخصص تبع الاو بي جايني او حتى في التشوزنج سبيشاليتي اللي مناسبه لك. في نفس الوقت دكتور نحب نشكرك اخر شيء، وتشرفتنا صراحه في هذا اللقاء. ودكتور ياسر فادن، اذا عندك اي اضافه او اي كلمه في الاخير تفضل، المايك عندك.
جزاك الله خير دكتور عبد الله على يعني ادارتك لهذه الويبينار مع اطباء الامتياز وطلبه الطب. تشرفت اني اكون معاكم هذه الليله، وان شاء الله باذن الله اتمنى او ادعو الله سبحانه وتعالى لكم جميعا التوفيق، وانكم تدخلوا التخصص اللي يناسبكم باذن الله.
اللهم امين يا دكتور، شاكرين لك. ونشكر ايضا القائمين على هذا اللقاء، وحده خدمه المجتمع بكليه الطب والمستشفى الجامعي بجامعه الملك العزيز. نعود لكم ان شاء الله غدا في نفس الموعد مع لقاء جديد. شكرا لكم ونراكم على خير.
شكرا، السلام عليكم.